And it appears that that busy season is now underway, having started in October with a significant increase in RSV here in Ohio. This increase, while dramatic, has been in line with what we've seen across the nation. And while Ohio and much of the Midwest have not yet seen the waves of cases crest, it's encouraging to observe that some parts of the country, which rose the earliest, are in fact seeing RSV cases level off or even decrease. But RSV isn't our only concern. Unlike last year, a year in which we saw very little flu, we are also now witnessing a significant increase in influenza-related hospitalizations here in Ohio. As I've noted previously, the robust return of RSV and influenza as we enter our fall and winter is not entirely unexpected, given the similar pattern reported in the world's southern hemisphere, which just emerged from its winter. The result, though, of an early and dramatic spike in RSV and now an overlapping rise in influenza is high demands on our hospitals, and right now, most especially on our children's hospitals. Their emergency departments, urgent care centers, and primary care offices are all experiencing very high patient volumes. Now, this, of course, also leads to unusually long wait times for their patients. But there are a number of things all of us can do to help support our children's hospitals at this challenging time. And I'm pleased that we have with us this morning 3 guests on our call who can help describe what they're seeing and how we can help. But before we turn to them, I want to just briefly discuss a few symptoms of RSV to watch for, and also some prevention efforts that can hopefully help mitigate the pressure on our healthcare providers. RSV is spread through respiratory droplets and usually causes cold-like symptoms. These droplets can settle in the eyes, nose, or mouth of another person, but they may also settle on common household items, such as tables, doorknobs, and cell phones and tablets. As a result, you can get RSV by touching these surfaces, then touching your own eyes, nose, or mouth before you wash your hands. Now, most people with RSV really do not need to go to an emergency room, and most RSV infections resolve on their own in a week or 2. There are some, though, who are at risk for more severe disease from RSV, including very young children, older adults with chronic medical conditions, and those whose immune systems are compromised. Now, parents of infants with RSV should be especially alert for certain signs and symptoms like decreased feeding or activity levels, fever or wheezing. The most important step that parents can take to prevent the spread of RSV may also, in fact, be to keep their sick children home from childcare centers or from school. Next, we want to encourage concerned parents to contact their child's medical provider promptly, recognizing that the majority of patients can be cared for in the primary care setting, whether virtually or in person, or in an urgent care, rather than in an emergency room. Parents and caretakers, though, need to pay particularly close attention to babies because they can get into difficulty much more quickly and may require much more rapid response. You should seek emergency care for your baby if you notice unusually fast breathing, ribs pulling with each breath, or a bluish color of the lips or face. Also, a fever of 100.4 or higher in infants up to 3 months of age is a very significant concern. Unfortunately, at the moment, there is no vaccine for RSV. There have been recent encouraging results in clinical trials, but we simply do not yet have an approved vaccine available for this fall and winter respiratory season. Nevertheless, We do have vaccines for both influenza and COVID-19, and it remains very important for parents to get their children vaccinated. Indeed, sadly, we've already seen a few pediatric flu deaths here in the United States this fall, which reminds us that the flu can be deadly, that the flu is not something to be taken lightly and is certainly not just a cold. Now is the time to get the family vaccinated against flu, particularly with Thanksgiving just around the corner. Now, I'd like to turn to our three distinguished guests who can help us better understand RSV, the importance of influenza and COVID vaccinations, and what's happening in our state's children's hospitals. First, joining me today is Dr. Rustin Morse, the Chief Medical Officer at Nationwide Children's Hospital. Good morning, Dr. Morse, and thank you for joining us. Can you describe the situation right now at your hospital in terms of capacity and how you're handling this increase in patients? What kind of steps are you taking? What kind of steps can the people in the community take to assure there are beds available for those who need them most?
Thank you, Dr. Vanderhoff. I appreciate the opportunity to be here this morning. As you stated, just stepping back a moment, every year children's hospitals and pediatric practices experience winter viral illnesses, including RSV and influenza. So that's normal patterns for us, especially pre-COVID. We get busy in the winter months, we staff up for that, we get through it, and the volumes then subside a bit. What is really unique this year is it's come much earlier than usual, and the volumes are much higher than usual. And year to year, volumes do vary, and the acuity this year seems much higher than usual. So the combination of earlier, higher volumes, higher acuity, and then marry that with the continued ongoing staffing challenges all healthcare providers and facilities are having, it's making it exceptionally challenging from an operations perspective at a children's hospital level. And I know I speak for my colleagues in all the children's hospitals across not only Ohio, but the United States. We are all experiencing exceptionally high volumes in our emergency departments, exceptionally high volumes in our pediatric ICU, exceptionally high volumes on the floor for admitted patients. So we are taking necessary steps to optimize care delivery, including expanding our urgent care capacity, expanding our ER capacity to provide care for more patients in the emergency department. We're taking steps on the inpatient side to augment inpatient capacity by canceling scheduled or postponing scheduled surgeries or scheduled admissions that can safely be postponed so that we can maximize our ability to care for acute children with viral illnesses inside the hospital. We've also expanded our primary care networks capabilities of providing acute care for patients who need acute visits so that, as you pointed out, those patients and families do not need to come to our emergency department. And we've had to be very careful and judicious on which patients we accept as transfers to the children's hospital. We are all seeing and being asked to accept patients far away, and we've had requests as far away as Virginia and Missouri, and we've had to say no to those other hospitals in faraway states so that we can optimize our ability to care for patients inside the state of Ohio. So I think I'll pause there.
Thank you so much. Next, I'm going to turn to Dr. Patty Manning, Chief of Staff at Cincinnati Children's Hospital. Dr. Manning, I provided a very brief overview of RSV and its symptoms, but could you perhaps give us a better idea of what parents should be looking for, when they should get worried, and maybe also when should they be making the decision to keep their child home out of public settings like daycare or school?
Sorry about that. It took me a second to unmute. Thanks, Dr. Vanderhoff. These are great questions, and we really want families to be as informed as they can be about when to worry and when not to worry when it comes to RSV and other respiratory viruses. So as you shared, there are some signs and symptoms that children show and that particularly babies will show us. And babies have just a very few ways of showing us when they're in trouble, right? They can stop eating. They can get kind of sleepy or lethargic, hard to arouse, and they can change the way that they breathe. And particularly for babies under 6 months of age with RSV or suspected RSV, we want to watch those three things very carefully. We want to watch how they eat and drink. Are they making wet diapers? We want to watch how awake they are. Are they easy to wake up? And we want to watch how they breathe. If they're breathing very quickly, if they're using their muscles to breathe, their neck muscles or their stomach muscles or their rib muscles to breathe, then we're very worried and we want you to bring them to seek emergency care. We always want you to consult with your primary care provider, your pediatrician or your family practice doctor if you have questions before coming to the emergency room. But if a baby's exhibiting those kinds of symptoms, we want you to act very quickly. Now, for most children, RSV starts as a cold. It starts as a runny nose, a cough, congestion. And for a child who has those symptoms, they're not only ill, but they're contagious. And one of the best ways to stop the spread of viruses like RSV is to not be out in public when you're sick. So if your child has a fever, if they have obvious cough, cold symptoms, if they have a runny nose, and we know that kids aren't the greatest at keeping their hands clean and blowing their nose, then we do want you to keep them home from school and home from daycare, because that's going to stop the spread to other children, as well as help your child get healthy more quickly. There are other ways to prevent the spread of RSV that we can speak to. If you do have to be out and about and you think you're sick and have symptoms, and as much as we talked about this during COVID, it really applies during any respiratory season, and that's wearing a mask. COVID taught us so much about the benefits of a very simple, cheap, effective intervention when you've got respiratory symptoms, or when you're out and about and you're afraid of getting symptoms from other people. You can wear a mask, as can children as well. But if they're sick and they have cough, congestion, fever, we want you to keep them home.
Thank you so much, Dr. Manning. Next, I'm going to turn to Dr. Claudia Hoyen, Director of Infection Control at University Hospitals and Rainbow Baby and Children's Hospital. Dr. Hoyen, what about vaccination? What role does getting our children vaccinated against the flu or COVID play this year as we're facing this increase in respiratory illness and the spread of viruses? Dr. Hoyen, I think you might be muted.
As I wanted to make sure I didn't make noise during Rustin and Patty's time. Thanks so much for having me. And it really is such an important year for all of us, not only our kids, but for all the adults as well, to be thinking about getting our flu shots and our COVID boosters. And it's for many reasons. First, it's to protect ourselves and our children. We know over the years, we've been giving flu shots to children for many, many years. And we know that with the flu, children are really drivers of the spread of that infection. And so years ago, the CDC realized it was important that children also get the flu shot. It works well for them. We fortunately have a good match between what is circulating and what's in the shot. And so we know that we'll see good success if people get the shot. The reason we want to be getting the shot this year, as I said, are several fold. One is to protect ourselves and our children. I know that you mentioned that we've already had pediatric related flu deaths within the United States. And I can say, sadly, we've experienced that at Rainbow already. And so I know it's hard for people to realize, but you know, we do see children die of the flu. And again, this is really a vaccine preventable disease. And so we want to be doing everything that we can to protect our children and ourselves. Another good reason to think about the flu, getting the flu vaccine this year is just for what Rustin and you were talking about in the fact that our hospitals, especially our pediatric hospitals right now, are overwhelmed with patients. You know, RSV has hit us hard this year and has hit us early. But right on the tails of this, we are already seeing many more admissions to our hospitals for the flu. Our staff are tired. It's been a long 3 years, and we need to do what we can as residents in Ohio to protect our healthcare system here in Ohio, so that if somebody's in a car accident, if somebody develops cancer, we have room in our hospitals to take care of those patients. We know that by getting the flu vaccine, that the chances of ending up in the hospital are markedly decreased. And so we need to be thinking about that this year as we're weighing and talking with our physicians and deciding on our flu vaccine. Again, everything that I've mentioned is the same for the COVID booster. And again, we need to be thinking about getting a COVID booster as we're moving through the season. With RSV, at some point will be behind us. Flu will also be behind us. And that will allow a lot of space, especially for the new variant, the COVID BN1, which is rising daily across the country, to take hold. And so we want to be prepared within our communities with the highest level of immunity in people, so that the spread is less and that fewer people are getting severely ill and ending up in the hospital and potentially dying from these diseases. So really an important thing that we can all do to not only protect ourselves, protect others in the state and those that we love, friends and family around us, but also to protect our healthcare system, so that if we develop other medical diseases and problems, that there will be room for us to be taken care of with quality care.
Thank you again, Dr. Hoyen. Well, as we wrap up for today, I want to reiterate how important it is for all of us to be prepared for this year's winter respiratory season. COVID, as we've noted, remains active in our communities. RSV has been raging and impacting especially the youngest among us. And now we're seeing this rapid rise in influenza. All three viruses can and do cause more serious illness, landing people of all ages in the hospital, and as we've noted, sadly, causing deaths. Never before have we had, though, to contend, as it appears we will this winter, with all three of these viruses driving illnesses at one time. In the face of this, what has been called triple threat, we need to use all the tools at our disposal to keep ourselves, our families, and our communities safe and out of the hospital. This, as we've noted, certainly means good hand hygiene, wearing masks when needed, good indoor ventilation, and of course, getting a flu shot and, if needed, a COVID shot. Our mission statement here at the Ohio Department of Health is advancing the health and well-being of all Ohioans. And it's my hope that through prevention, making informed decisions, and by getting vaccinated, all of us can help do just that, both during this fall and winter and beyond. So thank you, Ken. I think we're now ready to be able to take questions.
Okay, thank you, Dr. Vanderhoff. Our first question today is from Taylor Nimmo, WCPO.
Hello.
Hi, I just wanted to ask, with the holidays coming up and many people are going to be traveling or gathering with their families, so is there a concern about a potential surge in flu cases and how this may impact our hospitals?
Yes, absolutely. And I think that's one of the calls to action that you're hearing from us today. We're already seeing a significant rapid rise in flu cases landing in our hospitals. You can go to our ODH website to see some of that information and data. But we also know that the more of us that get vaccinated, the lower the risk that we're going to see those numbers continue to climb. And we also know that the more of us that get vaccinated, the less likely it is that we're going to see some of the more tragic results that can happen with the flu, which kills people every single year. Colleagues, anything you would add? I know, Dr. Hoyen, you were referencing this in some of your closing comments.
Yes, exactly. And that's why the timing of this talk today is so important. We do know that people are going to be gathering. In most years, what happens is the start of RSV will happen around Thanksgiving. And that's how it really will start to spread, and we'll start to see some flu activity. This year, unfortunately, we're already in the thick of it. And as Dr. Vanderhoff was saying, we need to protect as many people from ending up in the hospital as we can, as people are going to be coming together already during a time when RSV rates and influenza rates are so high. So really, our message today is, we want to be able to spend time with friends and family. We want to be able to celebrate together, but let's do that safely, and let's protect all of those around us and ourselves by getting vaccinated.
Okay, our next question comes from Ashley Bornanson, and I'm sorry I don't have a media outlet for Ashley.
Yes, I'm with 10 TV WBNS in Columbus. I've been talking to daycares, and some don't know at what point to turn away a child. Should they be turning down children to come to daycare as soon as they start showing symptoms of any potential sickness, or at what point? How should daycares be handling this besides keeping sanitizing the product?
Yes, so a number of things that we've mentioned that daycares can certainly be doing, and I know many of them are. First, it begins with just being very mindful of their physical environment. As we shared, some of these viruses can actually be shared or spread off of surfaces. So having clean surfaces, very, very important. Having children as much as possible, and we know that with little ones it is challenging, but as much as possible, washing their hands, especially before they do things like eat, etc. And having good ventilation in the daycare. But there's also this very important partnership that needs to occur between parents and the daycare. We really strongly encourage parents, if at all possible, to be identifying ways that they can keep their children out of daycare when they are exhibiting these respiratory symptoms, cold symptoms, etc. I know it's hard, but it is so important for the other children and for the community. And these viruses are just so easily spread when people come together. And then, of course, lastly, especially as we're thinking about COVID and the flu in particular, we need to consider, have we had our children vaccinated against the flu, which can be such an important tool for helping to reduce their risk of coming down with influenza. I'll open it broadly to my colleagues, pediatricians, all. What would you add?
This is Claudia Hoyen. Many of the daycares, and I know that even if you go to the Ohio Department of Health site, there's lots of information about, when people should stay home, especially if you are having a fever, you really shouldn't be going back into a daycare or a school setting until 24 hours after that fever has resolved. And in terms of, people are going to be most contagious during the early parts of whatever their illness is. So that if somebody's coming, if they're developing new symptoms, that's really the days to keep them home. After several days, the fact that your contagiousness goes down, it's safer for you to kind of get back out. So really, a lot of the daycares that I work with here in Northeast Ohio have great established guidelines. And again, popping on a site like ODH or the CDC can give people some really great information about when it's when it's best to stay home and safe to get back out there.
And, Dr. Vanderhoff, I might just interject at this point that at the risk of oversimplifying, I think Claudia made the point that the standards that have been in place for daycares around ill children really still apply. RSV is not new.
Yeah.
In years prior, we didn't talk about it as explicitly as we are now because we are dealing with a very unique combination of an early surge, a high surge, and a combo with flu surge. But the same practices that they've been employing for years really still apply today. There's nothing new.
Thanks, Patty. It's a good way to put it.
Okay, our next question comes from Maya May at WTOL.
Good morning.
Yeah, so I'm with WTOL 11. My question was basically, what is the reason for the spread of this? Like, why is it spreading earlier? And then also, why is it spreading at higher rates? And more specifically, is it being spread because of some of the quarantines we went into? Like, does that have anything to play a part with this?
Yes, so I think that it's an excellent question, and it is still somewhat, from a scientific point of view, an open question. We don't yet entirely understand this phenomenon. Frankly, we've never actually faced a situation quite like the one that we're in now, a period of time where other respiratory viruses essentially, disappeared or went into the background, and one virus was dominating among the respiratory viruses. But this phenomenon that we're witnessing, as I noted earlier, is one that we saw in the southern half of the world, which, as I said, just came out of their fall and winter. They're now in their spring. And as they went into those winter months, they saw very, very high activity of influenza, of RSV, along with continued COVID activity. So it is clear that that's what we should expect. It is what we are seeing clear signs of here in the United States and in Ohio. Again, I'll turn to my colleagues to see if they have anything to add.
So I just want to put out there that I'm old and I've been doing this for a very long time. And I can tell you that within my 25 years of being a pediatric infectious disease specialist, that we do see this with RSV. And, depending on when it starts, we sometimes will see a backup into the flu season as well. So although, as we said, we had a couple of quiet years, it is not unusual for us to have years where RSV is very prevalent, seems to be affecting more patients. I remember even 30 years ago when I was a pediatric resident, having to open up other parts of our hospital during RSV season. So again, it isn't that there's something terribly different with what's going on. It just seems to be timing. And again, the timing for our viral seasons are still a little bit off. As Dr. Vanderhoff noted, because we had a couple of years where things were very quiet. But as things are coming back, I am not surprised at all that we are seeing these things and not worried that anything more horrific is going to happen. But just want people to be aware that we know how we can help slow these things down. Because we've all learned so much from COVID and have a better understanding of epidemiology and infection control, and want people to be able to use that knowledge that we've gained over the last 2 years to try to make these next couple of months better for patients, families, and our hospitals.
Okay, our next question comes from Haley B. Miller, the Columbus Dispatch.
Hi, I was just wondering if you guys had any sort of top line numbers for how many cases of RSV in particular Ohio's seen, or if there's a place where we can dig into that data a little bit more.
Sure, I'll field that. RSV is not a reportable condition in Ohio. which means that providers are not required to report the cases to ODH. So we're not able to provide the kind of specificity that, say, we can with COVID. But the CDC has excellent surveillance data on the percent of positive tests that are performed by laboratories all across the country. And you can actually go to the CDC site and get some very, very good data on those laboratory results and that laboratory reporting. In addition, we of course work very, very closely with our hospitals to understand some of qualitatively what they are experiencing, and you've heard that today. But if you're interested in a good look at the data, the CDC's surveillance data, which again does capture what the laboratories are reporting, is an excellent source, and it does break down by region as well as by state.
Okay, our next question comes from Danny Subnosky of WSYX ABC6.
Hi, I was wondering if a child gets vaccinated this weekend, what's the turnaround time for them to be considered protected or safe? And is that enough time for Thanksgiving gatherings, or what's the gestation period, I guess, on that for it to kick in?
Sure, I'll start and then I'll turn to my colleagues. One of the things I routinely will say about influenza vaccine is it's never too late to get your influenza shot, never too late to get that flu shot. And we do see some immune response that happens fairly quickly in a matter of days. What we, though, do tell people is that these vaccines, to have their maximal impact, really require a week or two to get to that point where the immune system is, shall we say, fully revved up. But that doesn't mean that you aren't seeing some benefit to the shot relatively quickly after you get it. So while we would like to have as much lead time as possible, it's really never too late. And let me turn to my colleagues who work with children all the time.
This is Claudia. I would agree with what you said, Dr. Vanderhoff. It's never too late to get a flu shot. I've even in past years, told people in April, it's not too late, go get your flu shot. Because you have to remember, with the flu shot, there usually is more than one strain. Typically the flu shot that is out right now has 4 different strains, different influenza A's and different influenza B's. And as we go through the season, right now we're seeing one of the influenza A's that is in the shot and is a very good match. But that's not to say later in the season, we won't see a shift to one of the other influenza A's that's circulating or the influenza B's. So again, anytime you can get the shot, anytime during the season is great. The sooner, the better at this point. And again, if people were to get vaccinated in the next couple of days, they'd probably be at a really high level of immunity for the holidays. So I would encourage people to make those appointments, go out and get your shots. But as Dr. Vanderhoff said, it's never too late. The flu season typically goes at least through March, and last year it went through May. So lots of time and lots of opportunity to keep yourself safe.
Okay, we have time for one more question. I see a hand up. Brian Hamrick, WLW, do you have a question?
Yes. Yeah, real quick, actually, a kind of a two-parter. I just wanted to ask Dr. Manning, very similar to what Dr. Vanderhoff had asked Dr. Morse about what you're seeing at Children's and what's being done there. And then the other part was, Dr. Vanderhoff, you had said you had seen some decrease or plateauing, and if you could tell us a little bit about where that is and how that gives us any optimism at all.
Sure. Dr. Manning, why don't I give you an opportunity to start off, and then I'll wrap it up.
Sure, thanks. Thanks, Brian, for the question. So similar to nationwide, to Columbus, we are seeing record high volumes in our emergency rooms, our urgent cares, and in our hospital in general. We've broken our census records I've lost count of how many times we've broken. And for us, that means we have over 600 patients in the hospital. And that's a lot of patients in the hospital. And in our emergency departments and in our urgent cares, we're seeing sometimes double the volume that we typically see in those sites, which is leading to long waits. And we know that our patients and families have experienced those long waits. It breaks our heart to know that and to not be able to do more. What we're doing to try and do more is similar to what Dr. Morse shared. We have opened overflow units within the hospital to be able to handle more patients. We have set up overflow clinics to help our emergency room and our urgent cares. We've asked other providers in the hospital to come in and help out in those settings and offer extra hands to see more patients so that they don't have to wait as long. We've also communicated very directly with our primary care networks in the region, our pediatricians and our family practice doctors. And I'm so grateful, actually. This is one of those little moments of gratitude for COVID, right? COVID created a network of connectedness across our hospitals in our region, the adult hospitals and the children's hospital. So that when we need help in either direction, we can reach out to each other. So I've reached out to our adult hospital system leaders to say, hey, you know, we're in a tough spot. We may need you to take some of our young adult patients that we might typically take. They've reached out to their primary care networks, their family practice clinics, and we've reached out to primary care networks with pediatricians to say, hey, if you can expand your hours, if you can be available to see patients so that they don't have to come to the emergency department, that would be very helpful. And all of those things, I think, are helping a little bit to mitigate the very high volumes that we're seeing. We're hoping to see a little bit of a leveling off in the next few weeks, but we're still holding our breath on that.
And that's a perfect segue to your second question, which is, you know, what are we seeing in terms of disease activity and how do we monitor that? We're, as I noted, we have very good information that comes to us from national laboratory data that the CDC posts regularly and is able to break down on a regional and state basis, which is very helpful. It helps us to get a sense of how the RSV wave is moving in the country. And as we look at this particular wave of RSV, it really began in some of the southern portions of the country. And then proceeded from there around the rest of the country. Thankfully, what we're seeing in some of those regions is that the RSV numbers have hit a peak, a very high peak, but have hit a peak and have actually begun to decline. That certainly gives those of us in the upper Midwest, which is still in the midst of its wave, some encouragement that we might be able to expect a similar pattern here. Having said that, it's no guarantee, but it is at least an encouraging sign.
Okay, we'd like to thank all of our guests today. And Dr. Vanderhoff, do you have any closing remarks?
Yes, thank you very much. Well, first, I do want to again thank our guests here today, Dr. Morse from Nationwide Children's Hospital, Dr. Manning from Cincinnati, and of course, Dr. Hoyen from Rainbow Babies and Children's. Your expertise and input was very, very helpful. And I also want to just remind those who might be watching this, just how important your role is, whether you are a parent or a teacher or a provider in helping us to get through this. All of us have a role to play. Very important among those roles is making sure that the people that we care about have the opportunity to get vaccinated before they are seriously adversely impacted, especially this year by the flu. So thank you very much.
This concludes today's press conference. Thank you again for joining us.